In today's episode, I interview Dr. Michael Krychman about sexual health and libido. I'm so excited to bring this episode to you, and I made sure not to hold back on any of my questions because this is a taboo topic, but so important. Dr. Krychman is the executive director of the Southern California Center for Sexual Health and Survivorship Medicine, and he is the former co-director of the Sexual Medicine and Rehabilitation Program at Memorial Sloan Kettering Cancer. You will find him to be extremely knowledgeable and incredibly compassionate in this conversation. I learned so much and cannot wait to share it with you. And before we dive in, a couple of announcements. One, please do check out my show notes for all the helpful information about Fempower Health. I'll share with you links to episodes that are related to this, my Instagram account where I will post things that I don't fit into these podcast episodes, and also links to products that are mentioned in the podcast or that I think you'll like and I highly recommend. Additionally, if you like this episode, please do rate it and write a review on iTunes because that's how we can ensure that this gets to the top of people's playlists. And I do put the link in my show notes, so thank you in advance for doing that. Without further ado, let's talk to Dr. Krychman.
I'm a little bit different than most clinicians because I'm an MD and I'm also a sex counselor and therapist. So I kind of look at the whole picture. And with that caveat, what I would say is for many, many years, we looked at women primarily as having psychological issues when it came to being diagnosed with a sexual problem. Okay. And what that meant is, if you look at the traditional treatment paradigms, they said, go get a warm bath, go buy some shoes, take a nightie because you're depressed and you're frigid. But on the contrary,
it is so horrific. I remember when we first started getting to know each other, you shared that story, and I
yeah, it's like cringeworthy, right?
Yes.
And when you have a man, what happens? He comes in and he says, my erection isn't as wonderful as it would like to be. We instantly check his blood pressure and his cholesterol and his sugar level. We don't think that he's anxious or depressed. So it just shows the dichotomy, right? Women are heavily weighted in psychology and they don't really know. They really didn't put value on biology. And men, the same thing. We overemphasize biology and didn't put in psychology. And I think the important trend now really is to understand that it's an interplay between both. I always say women have veins, arteries, and nerves and hormones that influence tissue and responsivity. And, men get anxious and they get depressed and they have fatigue and they have psychological concerns as well.
Right.
So it's kind of, we're playing catch up and it's a delicate balance between.
No, absolutely. And I so appreciate you saying the complexity of it, because when I read your approach, depending on the condition, the approach was the same, which is really taking a very deep dive into the person. And it wasn't just your typical, do you exercise? Let's do some blood work. And have you had surgery? It's a lot deeper than that. So first I wanted to start with a data point. 40 million women have a sexual dysfunction. And the other piece that I found interesting is when I was researching the libido aspect, because that's what a lot of people have been starting to ask about and wanted me to talk about on this podcast. But there was a breakdown, and to me, they were so nuanced that I was very curious, how we can provide people perspective on what can impact one's libido. But there's libido, arousal, and orgasms. And so, this kind of struck me as, how does one know if they need to see a specialist? And the reason why I asked this is one of the themes I'm seeing in my podcast is we women, the more I learn, and I've been doing this a while, I'm still like, wait, what? That's not normal. And so I always like to start with, what is normal? And again, I think I qualify, there's the way people want to live their lives. There isn't like if you do this, this is exactly normal, especially when it comes to sexual health. I know there's a lot of nuances, but I think what I'm trying to get at is, for example, when it comes to periods, there's heavy bleeding and then there's normal bleeding. But if you're living with yourself every day, and you're not taught what that is, you kind of normalize whatever it is. So same with, sexual desire and libido, orgasms, and arousal. We may think whatever we're living with is normal, but there could be something even better. So how can you help us understand like a baseline of what it should feel like and be like to be in a healthy emotional state, physical state when it comes to sexual health?
Well, I think it goes back to the beginning of what you were mentioning, right? You were talking about women and who have sexual dysfunction, right? The 40 million women,
Yep.
the number. And I think we have to make a distinction between sexual dysfunction and sexual problem. And what I mean by that is sexual dysfunction is kind of this pervasive, invasive, distressing condition that's very impactful. And I think impact is very important. And a sexual problem, I always say, look to your right, look to your left. Remember, somebody's looking at you, and one of you has a sexual problem. Everybody has sexual problems, every single person. And what that means is sex waxes, it wanes, it gets better during certain times, it gets worse. We've seen sexual health really take a nosedive during the COVID pandemic. Too much of a good thing is not a good thing in terms of togetherness with your partner and your family, and four walls are closing in on you. So I think the important thing to remember is if it is distressing and distressing to you, then it's the point where you get help. And when I say get help, it's not necessarily only medical or psychological. It's you start researching how I can feel better, right? And it's the same kind of concept about what is I wish I could give you the right answer about what is normal, because I'm still trying to figure that out after being, involved in the sexual medicine arena for 2.5 decades. Sexuality and sexual expression is individually defined. So, we have to decide for ourselves, what do we feel comfortable with? So let me give you an example. So if we have a gentleman who is self-stimulating once a month and he's not troubled by it and he finds that it's, relieving and he's enjoying his life, then there's no problem. If we have another gentleman who is, self-stimulating 8 times a day and it's not interfering with his activities of daily living and he's not distressed, that still is normal. So when, normal is self-defined. We can talk about what is societal norms, what does society accept and what does it know, and that's very dependent on a variety of conditions, right? So we know in ancient Rome and Greece, same-sex relationships were accepted and embraced, and it was a form of changing from infancy to adolescent to adulthood.
Really?
Yeah, boys used to take an older male lover to teach him how to be intimate with a woman, and it was a transient occurrence. There are certain communities where same-sex relationships are accepted and what have you, but in others they're not. So
Got it.
very often sexuality is a function of the culture and a function of what's going on outside your four walls.
So if I'm reading Glamour magazine and it's saying, a normal sex life is this many times a week, et cetera, then I should probably, and by the way, Glamour, don't get mad at me because I just made up a magazine. I'm not saying you wrote this article. I have no idea who wrote the article. So a magazine. So that shouldn't be fair, because I will admit, and, I have to be vulnerable if I'm going to do a podcast here. I wonder, like, what is normal? Like, how many times a week? And I sometimes have asked friends and I never get a straight answer, by the way. And I have Googled this.
Alone. And you're not alone. You're not alone either, because everybody wants to be, accepted or above average, right? So, and again, I think your point is very, very well taken. And I think all these data points that we see in the news or magazines are really large surveys, right? So we can say, on average, the North American couple has sex X amount of times a year, or once a week is the average. But that doesn't translate into I would call satisfaction, right? So you can have sex twice a day and be unsatisfied and be the meaning behind the sexual encounter is not fulfilling, and it's not, you're not getting any kind of reward to it. Or you can have sex once a month and it's really a very emotional, wonderful experience. So again, it's this PRO, or patient reported outcome, that is really important. So we in the sexual medicine arena, we try to move away from what's normal, right? I don't know what's normal. Maybe it's, I don't know. And again, everybody defines their own normal. And I would say if you're having sex once a day and you're happy and that works for you and it works for your partner and you're not in distress and everybody is happy and you feel satisfied, then that's your normal. But if you're having sex once a day and you're not, and you want it twice or three times, and you're distressed and upset and frustrated and it causes marital discord and you're fighting, then it becomes a problem. So everybody has to really understand their own context in which they have sexual intimacy.
Okay. So then you said that where it could become a problem, because I guess it's then when do you seek help? Because you made a statement earlier around it impacting your life. So what does that mean, right? So for example, you're making a statement of if it's not enough or too much, then that's impacting your life. But then is that like, when does one know that's a discussion with my partner and we just have to negotiate versus there is something wrong? And this is complex because, like, for example, even you were mentioning earlier about self-pleasure. Are we allowed to say masturbation publicly? I'm going to, and hopefully no one gets mad at me. But like, there's shame involved. Like, I've seen books where it says women should masturbate once a day, get their freedom. And, then some people don't talk about it. Then you had recently on the Bachelor, where a woman shows up with her vibrator as a way to introduce herself to the new bachelor. I mean, it's all over the place. I guess, when does someone know when it's a negotiation versus when it's time to seek help?
Well, I would go back to the fundamentals of, partnership or relationships.
Okay.
Remember, we're always compromising. Every day we do something we don't really want to do in our relationship for the benefit of our partner and vice versa. And sex is no different. So we're always negotiating sex and what is going on and how often and what's to be touched and how do I like it and what have you. And I think, for me, if you are unhappy in the relationship because your partner's not taking out the garbage, you got to have a sit down discussion before you go to divorce court, right? Over the garbage. And again, I think communication is the most important thing. But for some reason, when it comes to sexual activity, we put it like on this pedestal, right? That we can't talk about it. We talk about, you always like to go for Chinese food or for, or for burgers, and I always like pizza. And you hope at the end of the day, you go for the same amount of burgers and pizza, what you love and what I love. But when it comes to sex, we feel like we can't communicate. So I think, for me, if something is troubling you and you're upset about something, it's good to share the burden and it's good to communicate initially. And very often, humans can problem solve. And very often things, as we said, they're problems and they're episodic and they're temporary and they have easy fixes and then they move on. But if something is persistent, I would say that is a really important issue. And you're persistently having negative feelings about yourself, about your relationship, I think that's the appropriate time to get professional help.
So then, I looked at several types of disorders, like I'd mentioned, libido, arousal, and orgasms. And the reason why I wanted to focus on that is I surveyed folks on my social media, and it was different flavors of libido that they wanted to better understand. I know that there's other things like pelvic floor dysfunction and other aspects, and I do cover so many of those topics on other episodes. And so I'll just leave that for folks to better understand, like how their pelvic floor should be operating and things like that. There's many episodes there. So I thought maybe we can just be really specific around the libido, arousal, and orgasms. And I'm curious why in some of the research that I did, they're differentiated I mean, are they really that differentiated? Are they just fine lines? Okay.
Let's start off with libido. There's a whole variety of different facets of sexual desire or fantasies or sexual interest. So libido, interest, desire are all synonyms. And in the healthcare community, we've transitioned from desire and arousal and orgasm to be separate and distinct. And now, by definition, we include desire and arousal together. And there's a big controversy. So you have spontaneous libido. That just is you wake up and you're interested and there's no stimulus. And there's some researchers that say there's always a stimulus. It's always reactive. You're reacting to something. And and then there's other people that say, reactive libido is you start off as neutral. A lot of women really need permission to understand that they can start off as neutral. They can take sex or leave it. They're not interested. They're busy. They have a lot of work in the home, out of the home, family, children, work, what have you. And sex isn't on their brain. But when it happens, it's nice. And those are, when the right cues are there, it's very nice to engage. And reactive libido is I start off, I don't really want to do it. But once I'm in the mood, I kind of realize, wow, this is good. And the best analogy I can give you is me and going to the gym. I don't wake up and say, yay, I want to go to the gym and go work out and it's going to be amazing. I couldn't care less if I go to the gym. I have 1,000,001 things to do. My buddy says, Mike, go to the gym, we'll work out, you'll feel better. So I don't really want to go, but I go nonetheless. And I'm working out and sweating and I'm saying, wow, I feel really good. I'm catching up with my friend and I'm feeling really good and this is great. I should go to the gym 3 times a week. I'm going to commit to do this more regularly. And you know what happens the next morning when I wake up? I say, only crazy people go to the gym. I'm so busy, right?
Got it.
So that means that sometimes you need arousal to convince you that your desire is there. So, by definition, desire is more thoughts, fantasies, wants, needs, and it could be spontaneous or reactive. Arousal is there's a lot of physiological things that happen. Increased breathing, swelling of tissue, rapid breathing, what have you. You see the physiological response in terms of engorgement and what have you. And it's a continuum. So it goes from desire to arousal to orgasm is the ultimate, people calling it the ultimate release. You have ejaculation for men and you may even have ejaculation for women as well. And then you have resolution. So it's a continuum of sexual experience. The important thing I think to remember is that you can get satisfaction at every stage. You don't have to go from point A all the way to orgasm to have sexual satisfaction. For some people, it's just being aroused, being close, being touched, and they feel very, very sensually aroused, or they may have, these tingling feelings. A lot of people culminate and want to have orgasmic release, and that is also perfectly fine for different individuals. So again, the way that I see it is it's really a continuum of behavior and one really leads into another, with the caveat that now we have arousal and interest for women that is really one disorder. We're not linking it or breaking it apart. We lump them together when previously they were separated. And the other issue I think is also to remember is, how does the brain fit into this? And I think it's really important because you can have brain-body disconnect. When you are a woman, your brain could be really interested. I want to have sex, I'm really interested, and your genitals are not responding, right? And vice versa. Your genitals could be responding and your brain could be turned off because this is just not in my scope of practice because I'm so horrified, but your body is reacting almost independently. There was this concept of subjective arousal and genital arousal. Subjective arousal is in your brain. I'm aroused, I'm interested, I'm really very much interested in what's going on sexually. And genital arousal is the physiological response. My tissues are becoming engorged, I'm lubricating, I'm really feeling the increased blood flow or what have you. So just because you have one doesn't mean you won't have the other, and they could be separate and distinct.
I'm still just so fascinated by when people should be seeking help, and because everything seems to be a continuum. And I think, like, for example, as I was listening to you talking, I think there's a lot of people who, and again, I'm not the person who sees the expert, so maybe you can confirm or deny this, is that there may be this false goal of always achieving orgasm, as it's not good until that happens. Seems to be that's the baseline, right? Is what feels good to you. And, trying to always focus on orgasm could be detrimental. And actually, do you find that as well, that some people focus so much on it must be that, if it's not, it's bad?
It's like the marathon runner who only focuses on the finish line. I think the important concept is the sexual journey. And when you become so focused on the goal, sometimes the goal becomes unreachable. And sometimes focusing on the goal of getting to the finish line prevents you from running the race, right? Because you're not focused on what's going on. You're monitoring your behavior. So I think the important concept of sexual intimacy is to focus on sexual pleasure. Focus on the journey to orgasm. And, it's not a failure if you don't have orgasmic release. You're still enjoying the journey that you have. There's always rewards from being sexually intimate. So I think that's an important concept that you make, is sometimes you get so goal oriented and so narrow focused and so existing with sexual blinders on, that you've got to reach an orgasm. You've got to reach an orgasm, and it has to be good. And if it's not a positive thing, if we haven't had it, that is, you get people that are very much in their head, right?
Yep.
And we always say that, there is a very, very strong correlative. So for women that are always in their head and always monitoring their response and their orgasm, they have a challenge to achieve it, because they're monitoring. How come I'm not having an orgasm? I should have an orgasm. This feels good and I want to have it. They have brain body disconnect, right? It's kind of like when you are playing football, you got to be on the field playing. You can't be on the bleachers monitoring the playing field. So when you start monitoring your orgasm, you kind of disconnect all those hormones that are going on, and neurotransmitters that are going on, in order for you to have orgasmic release. So the more you monitor, it's called spectatoring, the more you monitor, the less likely you're going to achieve your goal.
So I'm going to break this out a little bit, because as you were talking, there's a movie that Sarah Jessica Parker was in. I can't remember the name of it, but the beginning scene is, I think she's having intercourse or thinking, anyways, the bubbles are coming up where it's,
Right.
I got to take the kids here. I got to do this. I got to do that. And I talk to a lot of my friends, and it's like, yep. And so legitimately, we do have a lot on our plate, and everyone has it to a different degree. So I want to start with your recommendation there, but then I also want to dive into other things that can contribute to some of these challenges that we may have in our sexual lives. So for those of us who are in our heads, I will admit I am one of them. What advice would you give? Because it's like, well, legitimately, there's a lot. Where do I have space? Yes, I want to have fun, but also we women, we're caretakers, and we tend to worry about everything else first and then ourselves last. And so what's a realistic set of guidelines? Because just to say the statement, this is so annoying, I'll just relax. Like, so please
Right.
don't do that. I don't think you will, but
no, I think the important thing to remember is women are still the primary caregivers. They're still the cookers, the cleaners. They work in the home, out of the home. They monitor, Zoom calls. They are overwhelmed with a lot of things that are going on at a day-to-day basis. And you hit the nail right on the head. Women deprioritize themselves. I'm very about practical suggestions. The first thing is, I always tell women, don't feel guilty about taking care of yourself. And I think it's really important for women to take care of themselves. We're so busy taking care of everybody else that we don't take care of ourselves. Take 30 minutes. And if you want to just veg out and go for a walk or do yoga or read a book, be good to yourself. We teach from the moment that we're born, share your toys, be good to your siblings. We don't teach women or men to be good to themselves and to do good things for yourself. The other thing, there's practical suggestions. I mean, I think if we're humans are typically nighttime sex people, we've got to learn how to disconnect from all the other pressures that are going on in our lives. That means let's turn off anything that starts with an I, iPhone, iPad, nano, turn off computers, and decompress, and no electronics. I always say no electronics in the bedroom. I also think it's important to practice staying focused outside of the bedroom before you bring it into the bedroom. Because if you're in your head now, during this podcast, I can tell you're thinking about what's the next question? Where are we going to go? If you are already in your head outside of the bedroom, it's a natural extension. It's going to come there. Right. So I think the best advice, I know it sounds maybe a little corny, is but live authentically and live in the moment, mindful. When you are cleaning the dishes, you clean the dishes. You feel the water, you feel the soap, you feel the warmth of the water. It's a little bit more than stopping and smelling the roses. It's really staying focused in just 5 minutes a day of staying focused and staying in the moment, and then translate that into those activities during intimacy. And we know there's been studies that have been done. Lori Brotto, a good colleague of mine, she has done studies on mindfulness and sexual activity. And when you stay focused on your body and your responses, and you're really thinking about your body and how it's responding and the why am I intimate? He's a great person. She's a great person. And I really love her. And I want to stay connected. If you stay in the moment and you have focus, then it'll heighten the sexual response. So again, I think the best way, like I always say, the best way to have great sex is to start practicing outside of the bedroom.
That makes so much sense. What about medically? So if we use that as a baseline of the self-care, so we have the dynamics of the relationship, we've covered communication, then there's self-care. Now, medically, so I know like one of the things I saw a lot of is menopause, and I'm in perimenopause now, and I've also given birth. And I will tell you, I did not know this. And I think I've seen it in some TV shows now where people joke about it, I guess, in when the women are pregnant, they like always want to have sex. Holy cow, I felt like I was a 17-year-old teenage boy. It was absolutely insane what it was like to be pregnant. I was not prepared. So I definitely see from the extreme there and like regular living how hormones do play a role. And I know in menopause, it's very, very different. So that's one. And there's others too. So maybe you can just break down some of the things that can impact us that are potentially out of our control and even more so need guidance of a medical professional.
Right. So your point is well taken about hormones, but remember, it's an interplay of a lot of different hormones and neurotransmitters. It's not just estrogen and testosterone. And I can tell you, I see a lot of women who've undergone cancer therapy and they can't be on hormones, and they don't have one drop of estrogen and one drop of testosterone in their body, but they're having great sex. So there's alternative pathways. I really feel like if one area is, deficient, sometimes other areas get more heightened. And it's kind of like a multi-hit phenomena, right? So think about it. When you're 18 and think you're sassy and sexy and no one can stop you, and you don't have any kind of impact on your hormones and everything is great, and you don't have any stress or fatigue. And then you go and you're now in graduate school and you have a little more stress to study, and that kind of adds a layer of more anxiety and impacts your hormones. And then you get married and you have a kid and you have more responsibility. So it's a layered effect sometimes, that it's all these microaggressions that are additive. So when you were 18 and 19 and on birth control pills, and you could superimpose and supersede the lower testosterone. But as you get into your 30s, the lower testosterone may be much more impactful because you have all these other things that are kind of chipping away at your libido. So very often it's an additive issue when you're talking about insults. We know that there's medications, like antidepressant medications can influence desire and influence libido. We know birth control pills. Worldwide, over 300 million women are taking birth control pills. And for some women, they may have lower testosterone and it may influence their level of libido, but that's temporally associated. So if you say, oh, I started the birth control pill and 6-7 weeks later, I have no libido, that may be associated to medication. So we're looking at medication. Chronic medical conditions. Also, I have devoted most of my career to cancer patients. What we do, whether it's chemotherapy or radiation or surgery, we alter the anatomy, we alter what's called the sexual self-esteem, how we view ourselves as sexual people. That also can certainly influence your response. So chronic conditions, even age, we know the longer you're with somebody, the less sex you have. And that's just a natural progression of the human experience, right? And it takes a lot of work. People say, oh, it takes a lot of work. One of my fascinating things that I study is who are these couples that have been married 25, 35, 45 years and are still chasing each other around the room and having great sex. And
so tell me, what have you, because that was going to be my next question is, okay, are these people being truthful or are they making it up and making people who are like more typical feel bad? So tell me.
No, I think there's some credence to that. We see that they communicate very well and they focus on novelty and they focus on the daily activities of novelty, meaning they make sex fun. And it's not predictable. It's not the Saturday night special, right? We always have sex between 8 and 9 on Saturday night, and we are always in this position and what have you. So novelty is really important, and unpredictability. Plus, you get more comfortable discussing your wants and your needs and what have you. So I think it's a combination of those issues. When communication breaks down, that's when you start having problems with sexual activity. And very often people will come to me as a sex therapist or counselor or medical doctor, and they say, we're not having sex and we really want to have sex. And I said, okay, let's start at the beginning. And we find out that they don't want to even spend time together because they don't talk. They don't eat dinner at the same table, and they don't communicate about emotional things. They're just really operational. Who's taking Timmy to soccer and Kelly to ballet? They don't talk about their emotional connectedness. There's no preamble to sexual activity. There's no touching. There's no holding. There's no kissing. There's no oral pleasure or manual pleasure. They just want to go right to the sexual activity. So I said, look, that's the end game. Sex is the end game. Let's build from the beginning. And very often you'll find that somewhere along the road, they have had some breakdown in communication or discussion.
Thank you for that. That's really, really helpful. A couple of things. So I know that when we were originally talking about how things are so different for men and women, like one of the things that I was recently reading about is, we may talk about premature orgasm with men, and apparently women can also face this. And I was curious if you could comment on that, because again, this goes to how does one know if it's the case? And if it is the case, what can one do about it?
So, and again, a lot of these definitions are really self-defined. Like, premature ejaculation is before the man, wants to ejaculate. And again, there may be a medical component, but again, we also have to look at the anxiety component as well into that. And it's the same thing as delayed orgasm for both men and women. And very often there's this heightened sense of awareness and anxiety, and expectation. I think we have to realize that we need to set realistic expectations. And you hit it on the head when you were talking about a magazine, and they set unrealistic expectations and they make people feel bad
Yep.
about themselves, when in reality, it may not be perpetuation of truth, right? And it's the same kind of thing. We've seen it, the images that we see on a day-to-day basis of what is a sexy man or a sexy woman is not the norm of where we are. So it ends up affecting our self-esteem, and it affects how we view ourselves. Like, we can't aspire to that because that's unattainable. So I think it's really important to set goals and see what's realistic for you.
Again, as you were talking, I was envisioning how it really is interesting how all of these external factors in society impact us. But I will say we don't always know when that is happening. And I think it's so great to see things like meditation. I know the bullet journal has become common as like a way to like really start writing down kind of your thoughts and planning and things like that. I'm not trying to say now let's plan, because I know we want to go with the flow and get to know ourselves, but I think it's a way of like journaling your thoughts and whatnot. And it reminds me of a moment where I was living in California for a short period of time, and I did a lot of camping. And I remember when I was doing that, all I wanted was more outdoors. And I'm like, I guess I just need like more camping gear. And then the trip was done. Then I was walking in a city, and there were these beautiful windows with the fanciest clothing. And I'm like, oh, wow. And I'm like, it's the windows. If the windows weren't there with the beautiful clothes telling me that that's what I should be buying, I would not have cared, because when I was camping, all I wanted was to see mountains and the sunrise and sunset. And
Right.
so I think we don't always know until we get that shock to the system. We're like, wait a minute, it's the external factors. What do I actually want? And it's
Right.
such an interesting thing that we, I think, should really continue to focus on is who we are and what we need. And I think that's such a great baseline expectation to be setting for ourselves.
It's about a personal journey, right?
Yeah.
And it's about, life is about your personal journey of what you want to do and how you want to do it. And sex should be a part of that journey as well. And everybody we are a product of external factors, of course, and society, what they have expectations about us and what we should and shouldn't do. But I think it is really important to recognize that the journey in sexual function and sexual pleasure is really an individualized one. And people have different levels of frequency and different levels of satisfaction. And it's about navigating those when you're with a partner who has different levels than you. And again, compromise and communication is really important.
Great. And then if medical treatment is required, and I know some of it could be psychological treatment or psychiatric treatment, like what are the types of things that can be done? Like I was struck by when you were talking about cancer patients, how, where their hormone levels are, and you're still able to help them. So what does the solutioning look like
Well,
for?
what I would say for all sexual health issues, my approach is from conservative to aggressive. So
Okay.
conservative is behavioral things, bibliotherapy, reading books, talking about sex not becoming a taboo topic is actually something that will help your treatment. So there's a whole lot of exercises, date nights, spending time together, even walking on the beach holding hands when you couldn't stand each other before. Getting back to the basics is really important. So you can go from conservative to more aggressive treatments, and that's really, behavioral issues. Then we have nutraceuticals, herbs, and supplements that may be helpful. We also have hormones, estrogen, testosterone, variety of other things that we can use. And then there's also advanced medications that, there's 2 drugs that are approved for women. And again, they're not without side effects, but for some women, it's life-changing. And again, very, very important to kind of have that whole paradigm. And again, I think that it's an interplay. I think I want people to realize that it's like the depression model. You get one level treated by medicine, you get, to level 10. You get one level by therapy alone, you get to level 10. But if you add them together, you really get to level 20. So it's a combination effect. And you don't have to see a formalized counselor or therapist. It's just about doing the work.
Have you heard of the app Dipsy?
I have not.
You have not.
No.
I want you to download it and check it out. So I
Okay.
met the founder they have this great thing in New York City back when I had more time on my hands. It was called Founders Friday, and they would have founders of different startups come and present. And there's this young woman, and it's a sexual storytelling app. And there's like people who are being recorded, and she would talk the funny stories about how they would do the recordings, like crunching paper to make a certain sound and whatever. So they would recreate different scenes, and you can pick how intense you want the sex scene to be. And they do all sorts of types: women, men, men, women, whatever. And then she also has in there things I think that are like teaching you certain aspects of getting to know your body and like walking you through the steps of getting in touch. And it is truly amazing. And I just want to commend her, because I know when she was starting out, like Facebook and Instagram, it took a while to be able to post on social media because they were accusing it of being porn. And her intent was really, we all deserve to be sexual beings, and let's empower people to be able to do that. So it's a great app. So it's DIP as in Paul, SEA. And I think it's like $60 a year. So I admit I downloaded it because it's so amazing. I was like, wow, this is like, thank you. What a gift. So I would highly recommend that. So before we end today, I would love to get your thoughts on, what would be the one or two things you want people to walk away with for optimizing their sexual health? What advice and hope would you give them?
So I would say you're not alone, and don't suffer in silence, and recognize that even though you're hearing all these stories at the gym or reading all these articles, and everybody in the whole universe is having the most amazing sex and you're the one that's not, realize you're not alone, and there's no reason to suffer in silence. And when I say suffer in silence, I mean if you're troubled and it's upsetting you, there are kind, compassionate healthcare professionals, whether they're medical doctors or nurse practitioners or counselors or therapists, that want to help you attain sexual vitality. And the other message I would say is, sexual health and wellness is general health, and it's a right. And it's something that everybody should aspire to achieve, but it's defined by themselves.
I love that statement. Now, given you are doing so much research and working with so many different types of patients, and thank you so much for what I would call it almost advocacy work that you're doing for it, what would you say is your greatest hope?
Well, I think I'm living my greatest hope is that women are becoming empowered. And I'm fortunate enough to choose projects where I want women to be empowered over their career, over their sexual health, over their bodies. And I really think that we are now seeing a trend towards women becoming more and more interested in sexual health and in optimizing, and not really deprioritizing themselves. So I think the biggest issue for me is that we're moving in the right direction. And
Good.
we're seeing more direct, we have 2 medicines, and hopefully we'll have more for women. And, I think the paternalism where you have a male dominated society telling women what to do is hopefully over. And, I'm all for women being advocates, and especially advocates for themselves as well.
Thank you so much for your time. This was such a great discussion, and I really appreciate you sharing your perspective. And I know it put a lot of ease on my mind too, because I've always just been so curious, and no one tells women anything. No one tells many patients much of anything. And so it's
Right,
just great to hear from the experts.
and that's an important point, and it's probably the best point to end on, is keep the discussion going.
Yeah,
It's
that's
not,
true.
it's not an embarrassment. It's not something you whisper. And I think we all fall victim to that. Remember, you said, I hope we can say the word masturbation, right?
Yep.
We still have work to do if we're thinking that.
I know. Well, I remember the statement you made where you were talking to on the Today Show, and they were like, you can't say the word vagina. So I'm just like, I don't know what's allowed these days. So I just don't want someone to delete this podcast episode.
Right. I hear you. I understand. Have a great day.
You too.
Thank you.
Bye-bye now.
Bye.
Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.